So we're making a really quick video just to talk to you about the training that the HIT commissioned on trauma and adversity informed practice. My name's Sarah Stacey. I'm a clinical psychologist working for AWP within the Bristol Roads treatment system. This is Kate.
Hi, I'm Kate Bissix. I'm the senior practitioner for the specialist interventions and transitions team in Rhodes, but currently on a secondment to the CJIT team in South Gloss.
Wonderful, massive job title. Thanks, Kate. So we're making this because it's really important to both of us. I think that drug and alcohol treatment services begin to work in ways that are more trauma and adversity informed. We know there's a really high prevalence of adverse experiences in our population, something like up to 90%, research estimates vary. So it's a huge issue for us to think about in treatment services. Kate, is there anything that you'd want to say about why it's important to think about this in the work that we do?
I think it's important because I've seen the effects it's had on clients when they haven't received a trauma-informed treatment and the way they get labelled, and that's really horrible and really hard for them.
Yeah, absolutely. So I think we're both really passionate about this issue, and we were really pleased to hear that the HIT were commissioning this adversity and trauma-informed practice training. So they paid the Nelson Trust to deliver some training earlier this year, and there were 24 people from across Bristol, North Somerset and South Gloss drug and alcohol services who attended. Kate was one of those people, and another 23 people, some of the same attendees, also went to some training about self-care for practitioners thinking about how to look after themselves. Kate, can you say just a little bit about what the content of the training was, what was covered?
I think the contents covered quite a vast area of trauma-informed care, but it also highlighted how little some of our practitioners knew about it. So a good part of it for me was the fact that they helped them to understand that it's not healthy for people to just give their whole story over and over again. Yeah,
absolutely. I think that's a really key message, isn't it? And I think there was some skills as well, sort of thinking about how to help people to ground themselves and to sort of stabilize and manage that kind of physical arousal that they might be experiencing. And what have you done with the training? So it happened in March, I think, Kate, didn't it? What have you been able to do in terms of taking it back into your organisations? You've worked across a couple within the treatment system.
So I've, in particular, the self-care stuff, I took into the teams that I've managed, and with myself, I looked to recognise when some of our practitioners were struggling and realising that they'd come out of really difficult sessions, and then allowing them time with someone to discuss what's going on, and promoted that throughout the services as well, that the practitioners also need time to talk about what's happened and talk about what goes on in their sessions. Otherwise we are going to have, and we do have, a massive burnout rate around this. I've also discussed with other practitioners how to manage it when people are talking about their trauma, what's healthy for them and what's not healthy, and basically promoting the fact that it's okay to stop people from talking about their trauma in depth. It's okay for just to teach them to label it and move on from it.
Yeah, absolutely. All of that. Thank you. And I think there were a couple of quotes from other people who attended saying it was really useful to be reminded of how I need to look after myself, and that the trainings made this person think about how they respond to clients, being aware about how people might be survivors of difficult experiences, but perhaps not necessarily acknowledging that. And so finally, what next? You know, what's coming next for you, Kate, in terms of what you think we should do as a treatment system, what we might need to ask the HIT to do?
I think the training was a drop in the ocean. I think there needs to be further training across the board. You know, like I said earlier, it really highlighted how little training some of the practitioners have had. It was an amazing bit of training, but like I said, there was, I think, 23 people attended that, and there's hundreds of practitioners across those counties that all need this training.
Yeah, I'd agree, absolutely. I think training is great, but it's seeing that as part of a wider bit of work about how to really embed this learning and these approaches within, you know, treatment providers. And I think there's work going on with the trauma subgroup of the integrated care system to sort of connect us with other people working in the area. So I think we can be really excited about what comes next, but acknowledging that this is a first step, isn't it? A good start.
Absolutely.
Yeah.
And we're really grateful for that start. Thank you.
Thank you, Kate. Thanks, everyone.